All right, we're back here from Texan Live Studio. We have Mr. Joe McNeil, as always, and Mr. James Herman from Memorial Hermann Northeast. Robert, take it away.
James, it's a pleasure to have you out here, but now I have to confess, I did not like you guys. Anytime I ever had surgery, and I had more than one of them, the first guys I usually saw was you guys telling me to do something no possible way I could do.
Something that hurt.
Yeah, exactly right.
Something that hurt a little bit.
Yeah. Tell us a little bit about what you guys do when you come see the patient. I know most of the time I'm assuming it's right after surgery, but I'm sure there's sometimes that you work when there is no surgery. Is that?
Yeah. A lot of times I'm in the sports medicine rehab department, so we see a lot of outpatients. So definitely be after surgery for a lot of patients, but a variety of them without surgery. See a lot of knee pain patients, especially sort of vague, non-specific knee pain. A lot of times in young female athletes, and so that kind of gets a diagnosis called patellofemoral pain syndrome. And so typically they used to do surgery on those type of patients, but not so much anymore. More rehab.
Tell us exactly what, because my wife asked me this last night when I was reading this. She said, "Do you even know what the patella is?" And I said, "Yes, I do." So tell those people out there exactly what the patella is and what kind of injury we're seeing with the patella.
So the patella is basically a floating bone within the thigh muscle tendon, and it sort of rides inside a little groove of your upper thigh bone called the femur. And so if that tracking or that alignment or the kneecap doesn't ride just right, it can cause a lot of irritation, a lot of pain around the kneecap area, around the patella. And what they've figured out is through some research, biomechanical analysis, a lot of times that's related to weakness in the hip joint, actually. So a lot of the hip joint weakness is actually related to making that kneecap track properly.
So where are we seeing the patella injuries? Immediately, I would think long distance cross country guys.
Yeah, a lot of cross country runners, volleyball athletes. So a lot of, it used to be called a jumper's knee also. So basketball players would get it. And again, we see it a little bit more common in the female athlete, just because of sort of their bone structure and how things line up in the female athlete. And now they're obviously getting more athletic these days. A lot more female athletes. So sort of relates to a lot more female knee injuries.
I'm going to turn this over to Gerald in just a second, but I want to ask you, how have you seen medical treatment evolves almost daily, doesn't it? And how have you seen it evolve over the years and really over the months? I mean, it just changes every day.
Yeah, for those type of knee pain problems in the past, they would do a surgery called a lateral release, where they would kind of release the outside kneecap ligaments and then do a lot of strengthening for the quadriceps or the thigh muscle. And now they didn't get very good results with that, still had a lot of problems post-surgery. And then that's where the research turned to a lot more focus on the hip joint and the biomechanics of the hip joint and the strength in the hip joint as a big player in knee pain. Yeah.
Well, listen, I want to ask a little bit about the rehab. You know, nowadays, I want you to tell me, how important is it to get rehab quickly and how quickly you get up? For example, when you used to have, let's say that, a tear or a surgery on the knee, guy used to have a cast be up in for 3 months.
Yeah.
And, you have his leg, rotated up. But we don't see that type of things anymore. So tell me how important it is, to get rehab going and how quickly to get it going.
Very important, yeah. We'll see ACL patients, 2 days after surgery now.
2 days after surgery.
Early mobilization, early, trying to regain the muscle control, getting the muscles firing again has shown to be very beneficial, and not casting these people and let the muscles atrophy or shrink and just get a lot of stiffness in the joint. So, yeah, early intervention, early rehab is definitely shown to be a huge factor in getting athletes back to playing and back on the field and and just functioning better. So
I'm going to ask the same question Rob's been asking some of our physicians as they come in. I know Rob right now is taking a little bit of the stem cell. You know, it's not a surgery, but
Right.
it's just more of an experimental drug and things that are going right now. Tell me
Absolutely.
what your thoughts of that, because when you said that, to get it up and going, so I guess we're just trying to make sure that those cells kind of come together and get acclimated to the body a lot quicker,
Early
and maybe you
mobilization,
get back in.
Yeah, we'll decrease pain, decrease swelling, get the muscles firing again, so you start getting the normal joint mechanics back in the joint a little bit faster. The stem cells seem to definitely be helping, you know, on the cartilage of the regenerative side, as well as some other injections where they called PRP injections. So they actually take some of the white blood cell components out of your blood, spin them down, and then re-inject those into soft tissue injuries or into arthritic joints and things like that. So
Well, I see a lot of our
a lot of promise in that side of the medical.
on the medical side.
Yeah.
I just see a lot of our athletes that are going to that, especially right now in our professional athletes. And I just see, you know, it trickling down. It's just a
Absolutely.
matter of time that we're going to be using that with our collegiate and high school athletes,
Yeah.
because we're able to get them back on the field
Get 'em-
a
get 'em-
lot quicker,
get 'em
and
healed
you know
up, yeah.
that's real good.
Use their
So
own bodies, you know, own body's healing properties
Mechanism.
to make them
To make it
get them
right.
back on the on the field and
I,
rehab.
I was born at the wrong time, Doc. You hear me? Doc, I retired because I tore my quadricep in
Quad tendon?
1992. And you know, at that time they said, listen,
They stuck
it's
in
just
the cast.
I was stuck in the cast, and they said, listen, it's just like hamburger meat. There is no such, nothing we can do. It's kind of like, you know, you work, and
Tie
it's
it
got a
back
big
together.
old hole in my leg. Now I see guys coming back off of injuries in less than 6 months. So, you know, like
Absolutely.
I say all the time, you know, it's just so
still be playing,
appreciative.
man.
I know it. I'd still be playing today, making
If
some
you
of the
were there,
cash that
yeah.
those guys are making.
Yeah,
But,
put you in that
you know,
cast.
that's kind of awesome. So, Doc, thanks a lot for
they're
stopping
doing-
by
they're doing a great job.
and doing some of those things.
Yeah,
Okay.
thank you.
All right, now before we let you go, we're going to talk about this again, and because I say this every week and I rave about it, is the service that Memorial Hermann provides on Saturday for the young athletes from Little League all the way up to high school.
Absolutely.
Let's talk a little bit about that, and if they need to come get some PT, where they can find you.
Yeah, so we have Saturday morning injury clinic, you know, up at the hospital, medical professional building, and then from there, if physical therapy is indicated, great team orthopedic surgeons will get an order and get them down to our clinic, and we'll take care of them.
I tell people about this, and I'm out and about a lot, and I tell people about this, and they say, "No, I don't think that's right. You're missing something, Rob." And I say, "No, they're doing that right there in the Humble area,
Absolutely.
and it's a great service. And if they want to come and be seen by a professional, all insurance are accepted,
Absolutely.
and they'll evaluate you
Great-
then by a
great-
professional,
great team,
and move you on down the line
Yeah,
if
our-
they feel that something else is
Absolutely.
necessary."
Yeah, we have a great team of UT orthopedic surgeons out there, and then 3 different SM&R sports med and rehab clinics in the area to take care of them after that. So,
All right, I'm feeling a lot better about PTs now because I didn't like you guys at all.
We're good
No,
folks, you know?
no.
You always
Ju-
come in with the sad face.
Yeah.
But your goal is to make sure.
Very demanding, you guys are.
Gotta get it going. That's it.
All
Get
right.
it going.
James Herman,
guys.
physical therapist, Memorial Hermann. We'll be right back here at Turner Stadium, Atascocita homecoming, and we'll be right back.
Hang on just a second. Let me jump right in there, Rob, because we're gonna actually take a break here in about 5 minutes. We're gonna go. We got Tiny Meeker standing back there. We're gonna bring him on. But as we do starting 2 weeks ago on Friday nights, we're actually gonna be doing a Friday night show here at halftime. We'll come in here. We'll update the scores around from the city. And that's all brought to you from the TexanDrive.com dealerships, Memorial Hermann Northeast, and Cerna Insurance, Pete and Martha, located right here on Will Clayton. And this is something that we just started doing. We'll do it live here tonight, and Gerald will come back. Then we're going to do a post-game after the game is over, and we'll go over. And there's some good matchups tonight. We've got Galena Park at New Caney tonight up at the Texan Drive Stadium. We have K Park at Dayton tonight, taking on Dayton. Right here, a big game. We've got teams that both have one loss in district. Atascocita Eagles, our home team here at Turner, and against Oak Ridge. And I was going through here. Barbers Hill is CE King. And we'll get back with you. Summer Creek's up in Conroe tonight, trying to make sure I'm not missing anything. But we'll be back in 5. Thank you.